For a San Juan County teenager, we're a chance to break the pattern of drug abuse and graduate from high school. For developmentally disabled adults, we're a guiding hand, helping them create something with their own hands. For a Navajo healer, it's a chance to speak his own language and respect ancient healing traditions. For a patient in pain, we're a dental clinic. For families who have lost loved ones, we're a glowing candle that honors a life. We are Presbyterian Medical Services.
Can I listen to your heart?
Our healing heritage goes back more than a century with the establishment of a Presbyterian church medical mission in the Southwest. We began life as Presbyterian Medical Services in 1969 and now serve the people of New Mexico with more than 1,100 employees working in nearly 100 programs in 17 counties and 40 communities. The mission of Presbyterian Medical Services is to design and deliver quality, accessible, integrated health, education, and human services in response to the identified community needs of the multicultural people of the Southwest. To accomplish this mission, we provide everything from early childhood programs to primary care, behavioral health, dental, veteran, hospice, home care, and senior services.
The fact that we consider the medical needs in a community and our ability to meet the needs of the individuals in a community is what's helped us withstand the test of time as an organization.
Good morning, ladies. Okay, we may start.
A safe haven as well as a place to learn. The Little Feet Child Development Center in the Farmington area and the Flores del Sol Center in Santa Fe provide Head Start programs and create a supportive environment for many children.
This is our daughter, Summer Smiley. She's 2.
We work with children in early childhood education, but we also work with the entire family and provide a whole host of services for them in support of their own family goals. We have a home-based option, which is part of the Early Head Start program, and that works with pregnant women and children ages 0 to 3, where our home visitors go into the home and work with the parents on child development and how to be the best parent that they can be with their child.
She talks more and she likes to do stuff at home. Like she'll just pull out crayons and stuff and she'll keep herself busy, or she's like interacting with the other children when they come into my home.
It's really kind of cute to watch 1 and 2-year-olds use the words lovely, delicious. The ladies rock.
I love to see the impact this program has on the children and the entire family, getting the children ready for school, and just on a daily basis, seeing the children leave here smiling each day.
Toda is the Navajo word for a gathering place. It also means where rivers come together, and in Farmington, it's a welcoming place where the homeless, the mentally distraught, and those with chronic drug and alcohol abuse problems can receive help and counseling.
I was a dope addict, and I started hearing voices.
He said, you know, I want help.
Nikki, the caseworker that I have, she helped me get medication.
He decided to go ahead and go into our intensive outpatient program on his own. From there, we just started getting the ball going. He's living in a camper outside a friend's place.
And she helped me get Social Security and get on my feet. I just got an apartment.
He's still seeing the therapist. He's doing well, and now he has his own place. He finally got an apartment yesterday.
Nikki's been a big part of it all the way. The whole, you know, Tota's, I really think he's a great place.
It makes me feel good. It makes me feel good to know that I helped someone and that he's not living in a camper anymore.
And PMS has been really good at determining what the needs are in the community and really helping to fill them. You know, to have, say for example, 2 traditional healers on staff and recognized as practitioners, as providers of service, and supported in that way. I think that's unique amongst organizations the size of PMS.
There's 46 chromosomes, 23 are female and 23 are male.
The San Juan County Residential Treatment Center lies just outside of Farmington. Here, troubled adolescents have found a home away from home. Because of people like Trudy Fogg and her staff, these teenagers have a place they can trust and a place to help them build a new life.
We get boys and girls from the age of 13 to 17 years of age that have psychiatric issues happening, that a lower level of care, meaning being in the home or in a foster care, that type of stuff, is not an option at the time.
We are seeing more kids with more conduct disorders, more early childhood trauma issues, just a higher severity level.
We're the only residential treatment center for adolescents in the county. If we were not here, that service would not be provided.
The Farmington Community Health Center is a virtual lifeline for the residents of San Juan County, helping to change the lives of the people they deal with. For the spread out rural communities in the region, it provides services from birth to death.
We're a valuable safety net service, but much more than that.
Meeting the need for primary care and behavioral care for folks that don't have insurance.
For an Aztec, New Mexico resident, the center was a last resort for her to get much needed help. Although she can now go elsewhere, she has remained with the center for more than a decade.
I find that the staff is good, the wait time is short, and as far as the actual medical assistance I get, they work with you to get you well.
If PMS didn't exist in the communities that we were in, folks would simply go without care.
Also at the Farmington Community Health Center, Dental Director Clarissa Owen makes use of state-of-the-art equipment. Electronic dental records give her instant access to patient records. The result? Time saved so she can treat more patients and deliver a better quality of care.
We're really very unique in that we treat people with every sort of background, and we don't refuse treatment to anybody. And we're really the only place here in this part of the state that serves that role.
In Cuba, the job of dispensing medicine and healthcare falls to a handful of people.
PMS Cuba Health Center has a large array of services here. We have medical services, we have dental services, we have behavioral health services, we have the only certificated ambulance in northern Sandoval County that is run by PMS, and it's the only ambulance in PMS. We have lab, we have x-ray.
Right at that little square.
We are 75 to 90 miles from the nearest hospital in this area, and without our being here, many of our patients would not get health care.
It's a small building in the small town of Estancia, but it plays a big part in the life of the community.
Let's see on this side.
From medical care to dental care to preventative care, the dedicated staff treats people who might otherwise never get the care they need.
Can you watch my light? We know that we're making a difference in the community. We're changing the health care here. And so when you get to see the changes, there's people that are still alive because of things that we've done.
The Santa Fe Community Guidance Center, working with many city services, treat the medical, dental, and behavioral health needs of a large population.
We work with everybody who has a primary mental health issue as well as substance abuse issue. We serve the whole populace, no matter what their socioeconomic status is, their gender, their racial makeup. We basically help people keep out of the hospitals as well as the detention centers and stay part of our community.
I think one of the kids that sticks out the most for me was a young adolescent male who came to us for treatment. He was using heroin, and when we started to talk about his heroin use, we discovered that he was using heroin with his grandfather, of all people. So we worked really hard with the entire family, including 3 generations. We're talking about the grandparents, the mother, and the child, who all were using heroin except the grandmother. And we were able to give them the skills that 3 generations of family became heroin free.
We serve a function in this community that isn't available any other place. That without us being here, there'd be a huge void. These people have no other place to go but to come here. We offer services that they can't get otherwise. So instead of going to the emergency rooms and clogging up the emergency room and getting sporadic urgent care that they wait 4 or 5 hours for, they can actually have a regular doctor who knows them and cares about them and knows about their family and is able to treat them week to week, month to month.
In Rio Rancho, what started out as a small pilot program to help returning veterans has grown into a full-fledged treatment program for veterans of all wars, with counseling programs for family members and aid in adjusting to civilian life.
And we have families come in here and we do couples work. We do work with their children that are experiencing problems in school as a result of this. We do parenting, we do groups. It's the whole range. Substance abuse. So it's this kind of global perspective of looking at supporting the family unit.
Hi. Thank you for helping. Yeah, that's nice of you. Thank you.
In grants and throughout PMS, paper records are quickly becoming obsolete. Medical, pharmacy, behavioral health, dental, as well as home care and hospice are all switching to electronic records. Dr. Ellen Pierneau is helping to implement corporate-wide electronic health records to better coordinate patient files.
As you know, PMS has lots of clinics throughout the state, and we tended to do things slightly differently at every clinic. The advantages with the electronic health record, since we are one enterprise within the health record, we are learning to do things more alike than differently. We're becoming the role model for how well electronic health record can work if you put the resources in and really invest in a good system. We definitely have a Cadillac system, which was a major investment on PMS's part, but it's paying off in what we are able to do and where we will be able to go in the future.
In southern New Mexico, Southern Region Director Rex Wilson covers a lot of ground from Deming to Hobbs. Partnering with community leaders, he oversees nearly a dozen programs, all part of PMS's primary health centers.
Okay, go ahead and step on down.
It's our philosophy that if there's a need in the community, we want to be part of the solution. Our clinics serve the full range of people. We find ourselves serving an awful lot of the elderly population and their complicated needs. And then we also meet the needs of a lot of young families and kids. We take great pride in being in relationships and partnerships with people in the leaders of the community and other organizations in the community to meet the needs of those communities.
In Artesia, a dedicated dentist restores a teenager's smile.
Yeah, he was a 13-year-old, and he, at a younger age, he had lost one of his front teeth up here, and he was real conscious about it, self-conscious about it. He was too young to put a permanent type of bridge on there, so we ended up fabricating a what's called a Maryland bridge. It turned out to be a great result. He was very happy with it. He felt more confident, and so it made us feel good.
PMS's hospice in Santa Fe provides medical care for the dying and emotional support for members of the family.
Hello. Hi, Kay.
How are you today?
All right. Basically, it's clients with a life-limiting illness. The clients, their families, and their doctors have chosen comfort care for the patients to be cared for at home during this trying time in their lives. We have therapists, nurse aides, nurses, administrators, doctors, social workers, and we all work together as best as we can to provide professional assessments and information to treat the person as a whole. I'm going to listen to your heart. Oh. Okay, it's Christina here. Okay? Okay. Okay, Pita.
On a cold, wintry night in Santa Fe, mourners gather to say goodbye and honor the memories of loved ones. The blustering winds may have dimmed some candles, but not the spirits of those who attended PMS's Light Up a Life Vigil, an event held annually on New Year's Eve. 2010 marked the 20th anniversary of this meaningful event.
We're an organization with a heart, and that heart really is the mission, and the mission drives us as individual employees. We do a little bit more than we would as it just being a job. We come in to meet that mission.
For the people of Presbyterian Medical Services, it's much more than a job. To them, PMS is more than a service. It's a community where joy, laughter, a sense of pride and sorrow are shared every day.
I'm not in a larger facility in a big town because I love this area and I want to make sure that our community members get the services that they need. And that's what Presbyterian Medical Services is about.
I have never, across a number of states I've practiced, have worked with a better group of people than I have worked with here at PMS. And that interaction just makes the job for me.
PMS is going to have to be creative. We're going to have to focus on quality, and we're going to have to be flexible to navigate the unknowns that are ahead of us in order for us to survive for the next 4 years.
We're a new smile, a fresh start, hope, learning, memory, caring, community, comfort. We are Presbyterian Medical Services.